Silent, subtle, deadly. That's the reality of stomach cancer, one of the most overlooked killers worldwide. Right now, as you watch this, your stomach could already be showing signs of distress, and you might not even recognize them. According to the American Cancer Society, over 26,000 new cases of stomach cancer are diagnosed each year in the US alone, and the tragedy is that most are caught in the later stages, when survival chances drop dramatically. Why? Because the early symptoms are often brushed off as indigestion, stress, or just getting older. But your body doesn't lie. The discomforts you ignore could be your stomach's desperate warning signals. Today, we're exposing 12 silent symptoms of stomach cancer that most people completely overlook. Some may seem ordinary, but together they can paint a dangerous picture. Recognizing them early could mean the difference between life and death. This video is for educational purposes only and is not a substitute for medical advice. If you notice any of these symptoms in yourself or a loved one, please consult a qualified healthcare professional immediately. Now let's begin. Symptom 1. Persistent indigestion or heartburn. Everyone experiences indigestion once in a while, but if it's happening often, no matter what you eat, it could be more than just acid reflux. Stomach cancer can irritate the stomach lining, mimicking the same burning and discomfort as simple heartburn. But unlike normal reflux, this doesn't go away with antacids or dietary changes. Doctors emphasize that frequent indigestion lasting weeks or months is a red flag, especially if you never struggled with it before. Symptom 2. Unexplained weight loss. Losing weight without trying might sound like a blessing, but in reality, it's often a warning sign. Stomach tumors can interfere with digestion and absorption of nutrients. Your body struggles to get energy, and you begin losing pounds, even when your diet hasn't changed. This weight loss is usually sudden, noticeable, and accompanied by other discomforts. If you're dropping weight without effort, it's not just good metabolism. It could be your stomach signaling something serious. Symptom 3. Persistent nausea or vomiting. Occasional nausea is common, but nausea that lingers, or worse, frequent vomiting, deserves attention. When a tumor begins blocking or irritating the stomach, it can make food harder to pass, leaving you feeling constantly sick. Some people even report vomiting blood or material that looks like coffee grounds, a critical sign of internal bleeding. This should never ever be ignored. Symptom 4. Abdominal bloating or discomfort. That too full feeling after small meals or constant bloating that doesn't go away is another silent sign. Stomach cancer often reduces the stomach's capacity, making you feel uncomfortably stuffed even after a few bites. Many dismiss this as simple indigestion, but when it happens repeatedly, it could signal an obstruction or growth inside the stomach. Symptom 5. Loss of appetite or early fullness. Do you sit down for a meal and suddenly feel like you can't finish it? Or worse, you have no appetite at all. This is one of the clearest silent signs of stomach cancer. As tumors grow, they reduce the stomach's capacity, giving you that full sensation after just a few bites. The body also releases abnormal signals that suppress hunger. Many patients describe a slow but steady decline in appetite long before they suspect something serious. Symptom 6. Blood in stool or black, tarry stools. Changes in your stool can reveal hidden dangers. If you notice dark, tar-like stools or see visible blood, it could be a sign of internal bleeding. Stomach cancer can cause small blood vessels to rupture, mixing blood with digested material. People often mistake this for hemorrhoids or dietary changes, but it's actually one of the most urgent warning signs. If you ever notice persistent dark or bloody stools, seek medical help immediately. Symptom 7. Unexplained anemia. Have you been told you're anemic even though you eat well? Anemia can develop when slow chronic bleeding from the stomach causes your body to lose iron over time. This leads to pale skin, constant fatigue, and dizziness. Many people go months, sometimes years, treating anemia with supplements, not realizing the true cause is hidden in their stomach. Doctors warn that unexplained or persistent anemia in adults should always be investigated further. Symptom 8. Constant stomach pain or discomfort. Occasional stomach aches are normal, but when abdominal pain becomes persistent, dull, or burning, and especially when it worsens after meals, it could be more than just gastritis or ulcers. Stomach cancer irritates and inflames the lining, creating a pain pattern that often gets dismissed as just indigestion. The key red flag is persistence. If the pain keeps coming back, doesn't respond to simple remedies, and is getting worse, it may be your body signaling something more serious. Symptom 9. Persistent nausea and vomiting. Everyone gets an upset stomach occasionally. But when nausea or vomiting becomes a regular part of your life, that's not normal. Stomach cancer can irritate the stomach lining and block digestion, leading to frequent nausea. In some cases, people vomit partially digested food hours after eating, or even vomit blood. While many blame food poisoning, acid reflux, or stress, the persistence of these episodes is what sets stomach cancer apart. Symptom 10. Bloating after small meals. Feeling uncomfortably bloated after eating just a little is another overlooked sign. As tumors grow, they can press against the stomach walls, creating a sensation of fullness or tightness even when the stomach isn't full. People often write this off as gas or a sensitive stomach. But when bloating happens regularly after small portions, it may be linked to impaired stomach function from cancer growth. Symptom 11. Difficulty swallowing, dysphagia. Struggling to swallow food or feeling like food is stuck on the way down can point to advanced stomach or esophageal involvement. This happens when tumors interfere with the passage of food or cause narrowing at the junction between the stomach and esophagus. At first, it might only be with solid foods, but over time, even liquids can be difficult to swallow. Any unexplained swallowing issues should be treated as a serious warning sign. Symptom 12. Unexplained weight loss. Losing weight without trying sounds like a blessing, but in reality, it's one of the most dangerous warning signs of stomach cancer. Cancer cells consume enormous amounts of energy, hijacking your body's resources. Combined with loss of appetite, nausea, and poor digestion, this leads to rapid and noticeable weight loss. Doctors consistently stress that unintentional weight loss in adults should never be ignored. These 12 subtle signs, ranging from fatigue, indigestion, and nausea to bloating, swallowing problems, and weight loss, are your body's way of waving a red flag. The tragedy is that most people dismiss them until the disease has already advanced. But here's the hope. When detected early, stomach cancer can be treated far more effectively. If you've noticed several of these symptoms in yourself or someone you love, don't wait. Speak to a healthcare professional and ask specifically about your stomach health. 2 simple steps, an endoscopy and basic lab tests, can provide life-saving answers. Your body whispers before it screams. The real question is, are you listening? If you found this video helpful, type helpful in the comments, hit the like button, and share this with someone who might need to hear it today. And of course, subscribe for more life-saving health information.